Former Bachelorette star Hannah Brown recently revealed that she has a double uterus. Now, this is a rare condition that most people don't even know exists, so let's talk about it. When people use the term double uterus, they're talking about one of two things, either a bicornuate uterus or something called a didelphys uterus. And either of these problems can happen when the two structures that are supposed to fuse during fetal development, usually in the second trimester, these are called Müllerian ducts, they don't fully join, and this can result in two separate uterine cavities. And this can sometimes mean that everything is duplicated and completely separate. You have two cervixes, you even have a septum sometimes down the vaginal canal, so you have two vaginal canals essentially, and you can have two separate uterine cavities, or it can be more like a heart-shaped uterus called a bicornuate uterus, where you have two horns, but it is really one actual cavity with just two sections to it. So uterine didelphys is where there's two completely separate uteri, and then a bicornuate is where there's one uterus, but there's a deep division at the top, and that's where we call it heart-shaped. Both are congenital anomalies, meaning that you're born with them. Now, I often see the bicornuate uterus confused with something called a septate uterus. Now, a septum is different. It's also a problem that results when the ducts come together. They fuse normally, but there isn't that resorption step. So normally there's a wall in between, and then that gets reabsorbed. And that is when you have a septum, it's the failure of resorption, that final step, and that's fibrous and it's easy to remove. A bicornuate is muscular, it's the shape of the uterus. So unless you're cutting that muscle and trying to sew the two horns together, which is something that used to be more popular and used to be done, but now has kind of fallen to the wayside, you're usually just going to continue to live with a bicornuate, unlike a septum, which can be surgically repaired. Now, these conditions are very rare, affecting less than 1% of people with uteruses. They often will go undiagnosed until someone's trying to get pregnant, or maybe they're coming in to see me and they're doing an ultrasound for the first time because they're considering a process like egg freezing. I do pick things like this up a fair amount. While it is rare, it is something that I will on occasion notice and then bring someone's attention to. And I will counsel them that while they don't need to necessarily do something about it at this time, if they're not trying to get pregnant, it's something to be aware of and to talk to their doctor about once they are pregnant. So what does this mean for your fertility? Well, most people with a double uterus can still get pregnant, but they are at a known higher risk of miscarriage, preterm delivery, and the baby being breech. If it's not a septum, there usually isn't much of a role for surgical correction. And most of the time when it comes to a double uterus, a didelphys, or a bicornuate uterus, it's all about careful monitoring and potentially helping patients to tackle infertility if it seems to be interfering with their ability to get pregnant successfully. And in some cases where patients have had recurrent losses and they can't hold on to that pregnancy, there is a potential role for surrogacy. Having said all that, I've had many patients with uterine anomalies go on to have healthy pregnancies. It's important that they're managed by someone who's equipped to deal with any complications that could arise along the way. If you've been diagnosed with a uterine anomaly, do not panic. Talk to a reproductive specialist like myself to get a clear diagnosis, because sometimes people get misdiagnosed, but I always get a pelvic MRI to really understand what's going on with their anatomy, and then make a plan that fits your goals. Knowledge is power, and people like Hannah sharing her story helps to raise awareness and make other people feel less alone.